Welcome back to The Wellness Effect. Subscribe and hit that notification button so you stay up to date with all of our educational wellness discussions. Today, we continue the discussion around pregnancy. With me is Sister Heather Pieterse, who currently practices as an independent midwife. Welcome, Sister Heather.
Hi,
It's good to have you here again.
thank you. It's good to be here again.
So we have some more questions around the midwife and midwifery journey. But could you maybe explain to us the differences between midwifery and obstetric care?
So, obstetric care is provided by an obstetrician who is a specialist in high risk obstetrics. It's a medical doctor who specialized in gynecology and obstetrics for many, many years. So, traditionally, um, women that were low risk and healthy would be looked after by a midwife or a GP. And the obstetrician years ago, probably up to about 40 years ago, was there specifically for the high risk cases where referrals were needed and their expertise. That we've seen a change over the last many years where midwives and GPs have kind of fallen away and obstetricians have taken over the full sphere of obstetric care or maternity care, certainly in the private sector. In the state sector, we're still looking at midwives being the main caregivers of low-risk healthy women, having low-risk healthy pregnancies, and referral systems are for those with high-risk cases, and they're referred to obstetric care.
Mm.
So a midwife is there to look after women, to help them through their pregnancy, medically, emotionally, physically, through pregnancy, through childbirth, and postpartumly. And we do it all pretty much. Spend at least an hour per consultation, see the woman from before the baby's born, talking about planning. We do the medical care in a consultation, but then we also sit for another 40 minutes or so, depending how talkative the woman is, talking about what their fears are, what their plans are, how they're feeling about impending parenthood, how they're feeling about the birth coming up, what they're doing to prepare for the birth coming up, how they're preparing for parenting, how they're going to incorporate this new baby with the family. So it's a very, very inclusive model of care, midwifery, opposed to obstetric care, which is very specific generally. You're pregnant, there's your consultation, baby's doing fine, see me again in 4 weeks' time.
Mm. And what should you do when you find out that you're pregnant?
Well, it's a very exciting time. So the first thing would be to actually confirm the pregnancy. And that will, assuming that's been done, that's either with a urine pregnancy test, which is pretty accurate, very accurate, or a blood test. And then normally between about 8 and 10 weeks is a good time to go for your first sonar. So sonars are done, in South Africa, sonars are done pretty much with every consultation. But worldwide, and all research shows that sonars, unless there's a high risk situation, sonars are actually only necessary 2 or 3 times during pregnancy. But a good time to have a sonar would be between 8 and 10 weeks, and that's when they identify the pregnancy. They see if it's 1 or 2 babies, and also the viability of the pregnancy, where they can check and see the heart is beating. And you can already see the little 4 chambers of the heart beating so beautifully at that stage. Very exciting.
Mm.
And then normally they see you again between sort of 10 and 13 weeks, where you'd have another sonar and your first trimester screening would be done. And those are very significant checkups where they're checking for the risk of spina bifida and Down syndrome and various other things. You'll be sent for your routine blood tests as well at that stage. Also dating when this baby is the expected date for the baby, or estimated is a better word, estimated due date for your baby's arrival, which is just an estimated date. Nobody can tell you exactly when your baby's going to be born. And then after that, very important things. You need to have good diets, eating lots of good various colors of fruits and vegetables, eating healthy meals, making wise choices in terms of diet, remembering what you're eating, you're growing as well, and how would you want your baby to be grown with fresh fruit, organic fruit and veggies, or with, I nearly gave some brand names, or with takeaways and unhealthy choices. Easier said than done, but you want to try and think about what you're going to be eating in pregnancy carefully and try and follow a healthy diet. Taking vitamin supplements, exercise is really important as well. You need to exercise in pregnancy again if you've got the green light from your caregiver. Exercising in pregnancy leads to healthier pregnancies, healthier but smaller babies, an easier birth process, and healthier healing. And we all know, even if you don't want to exercise, if you do, you feel so much better psychologically afterwards as well.
Mm.
Really important. And then the other important thing is looking at lifestyle, trying to have a good balance between rest and activity. We live in a very busy world, very stressful world. We need to balance that out in pregnancy, well, in life in general. We need to try and balance it out with a bit of rest and relaxation as well. A bit of meditation, go and join up with a pregnancy yoga class or whatever it is, but find some time for yourself as well,
Mm.
where you can just be and be with baby as well.
Yeah, and what steps should a mom take once she's found out she's pregnant to have like a healthy pregnancy?
Well, that's pretty much what I've just said.
Okay,
The
great.
the diet, looking after your diet, exercise, looking after lifestyle, and then
Mm.
the other important thing would be to go for regular checkups. So there seems to be a misconception with some women about it's a waste of money to go for checkups, and nothing's being done at the checkups. And so we see women sometimes skipping their checkups, or it's inconvenient to go. But the checkups are really important. Pregnancy is all about preventing complications, and that's exactly what those checkups are, your antenatal consultations. It's about screening for complications, because if we can identify a complication or a high risk situation early, we can deal with it and we can actually help prevent pregnancy loss. We can help prevent pregnancy complications through good treatment and management.
Mm.
So the general rule for the antenatal care in pregnancy is every 4 weeks from the time you find out you're pregnant up until about 30 weeks. And then every 2 weeks until 36 weeks. And then from 36 weeks, the risk becomes much higher. And then it's every week until you give birth. And in those checkups, they're going to be doing your blood pressure and checking your urine for infection and protein and all sorts of things. We can tell all sorts of things just by dipping a stick into your urine. We can already get lots of ideas of what's going on. Measuring baby's growth, feeling what baby's position is, engaging with baby and showing you how baby's lying, and actually that forms part of the bonding process.
Mm.
Listening to baby's heart, all of that.
What are the biggest myths you encounter in your midwife practice?
It's an interesting one. And there's so many of them. I think one of the biggest ones for me is that it's not really a myth, but it's something that comes to mind, is that I'll just wing it. I'll just, why do we need to prepare for birth? But we live in a culture where you do need to prepare for birth. And it's a bit of a cliche, but we always say to the moms, would you go and run a marathon without preparing? Or would you get married
Hmm.
without preparing? And I can't think of anything bigger that you're going to go through in your life than giving birth to your child. So, yes, you need to prepare. It's a journey, just like going on holiday, getting married. Where are you getting married? Who's going to be attending? Who's going to be helping you, or who's going to be marrying you? I mean, in terms of doing the ceremony, um, all of that. So, it takes a lot of preparation. And I think that's the biggest myth, that I'll just wing it.
Mm.
Um, yeah, in other countries, possibly where normal birth is seen as the norm, but certainly in a culture where a Caesar is seen as the norm, if you want to have a normal birth, you do need to prepare. And even if you don't want to have a normal birth, you need to prepare as well. If you want a Caesar, prepare so you know what to expect. So you've got a bit of control in your situation as well, because we know that women can come to terms with their birth experience a lot more easily if they do feel they've had some control in the situation.
So we don't speak enough about postpartum depression. What should we know?
It's a postpartum depression. Yeah, that's the thing that nobody likes to talk about and nobody admits to it. Many years ago, I used to do a postnatal workshop for moms, and it was always so well attended. I mean, every class, it was on a Friday, and every class I'd have up to 20 moms attending with their babies. And the one class we did on postpartum depression, suddenly nobody would pitch up for it. And
Mm.
that kind of says it all. Women are are forgotten after the birth of their baby, and it's an extremely lonely time for a woman. There's a lot of attention in pregnancy, and you become community property, which every pregnant woman will agree with. When you walk in the shops, people are asking you, people are touching your stomach, asking you how you're going to feed your baby, and you feel really special. Then you go through birth, and that's special. You have lots of visitors, and then a week or so afterwards, people go back to work and life carries on. And that woman is left alone at home. Some of these women have not had any break from work to giving birth because they've worked right up until the end. They don't know how to be at home alone. And they definitely don't know how to be alone at home with a baby that has high needs and is screaming, and you have not got a clue what you're doing. It doesn't matter what expert you are outside of parenthood. As a new parent for the first time, you are really not an expert, and you have to find your way. It's complicated, it's lonely, your body's healing. It's huge. And that's where the system really does fail. We were talking about that just now. The system does fail us because if you've had a normal birth, you normally send home anything from 6 hours after birth up to 2 days after birth. If you've had a Caesar, you send home about 3 days after birth. If you've had a Caesar, you sometimes go back to see your doctor again a week later. If you've had a normal birth, they tell you to come back at about 6 weeks. After your week checkup post Caesar, you go back at 6 weeks. So what's happening to these moms in between? You don't need to do vaccinations for your baby until 6 weeks. And if it's your first time, you don't know necessarily about what resources are out there. And that is definitely where the system fails. That's what we do in our practice as well. We do home care for the moms, and they used to do it. When I had my son 29 years ago, we still had state clinic sisters that would pitch up at our door and ask how things were going, which was actually interesting, but also really nice. So yeah, postnatal care is super important. We come to the home of a woman, we check how you're doing, we check on the breastfeeding, are they healing from birth? We just give that little bit of emotional support. And then the follow through is also to check on their emotional well-being. How are they processing? Are they traumatized from a birth? Birth is up there with post-traumatic stress disorder, and that can feed into postnatal depression as well. They've got no outlet when they're left alone at home and nobody's there to talk to them. Women sometimes don't know, was it normal what they went through? Is it, they feel guilty because maybe they should be happy because they've had a beautiful birth and their baby's fine and they were able to have a baby in the first place. So what are they feeling guilty about? And there's nobody there to catch them and to help them through that. So postnatal depression is, as you can hear, a very big thing for me. And postnatal care for women after birth is a huge thing as well. And there's not enough care out there for women after birth.
And what can women do, knowing, maybe demystifying the stigma that you've just done now? What can they do? What are actionable steps that they can do prior to having the baby?
Yeah, well, the obvious one would be to link up with midwives because they offer that postnatal care.
Yeah.
But I think it goes further than that. I think hospitals should link up with postnatal resources in an ideal world. Doctors or the obstetricians should also in their practice, and if you're having a Caesar, they should have a link with the midwife. And there are thousands of clinic sisters and midwives and registered nurses out there that would be willing to take on a role like this, that's for sure. And then organize that somebody does go and touch base with this woman. If they can't get out to her house, invite the woman back to your practice where you can check on her a week after birth, 2 weeks after birth. Ideally, though, you want to go to the woman's home because somebody who's given birth shouldn't be out and about traveling. They should be resting at home and being looked after and cared for and nurtured. So there's one medical aid scheme in South Africa that actually covers that under their risk profile. If you're on that medical aid scheme, that specific one, you don't have to, it doesn't matter how you give birth. They cover 3 midwife visits to your home within the first 6 weeks of birth.
Amazing.
But nobody really knows about it. We tell people, are you on ... medical aid? But do you know that we can come to your house for free and do give you postnatal care? So yeah, I would say that's find out if you're pregnant, find out from your doctor, find out from your medical aid, will they cover it? Or just phone a private midwife practice because all private or independent midwives offer this service. Find an independent midwife practice and ask them, would you be prepared to come and see me once or twice after the birth of my baby once I've been discharged? I would highly recommend that.
So thank you, sister, for such a great conversation. I think it's the insights that you've shared are really going to help a lot of people.
It's a pleasure. I really hope it does help them.
And thank you for watching. Subscribe to the channel and make sure you hit that notification bell so you can catch every episode of The Wellness Effect. See you next time.
BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.